Pennsylvania saw its highest number of daily COVID-19 cases today. The state reporting 2,900 new cases, bringing the state total to just more than 220,000. So as those cases surge, State Health Department Director Dr. Rachel Levine is talking about vaccinations and what the distribution will look like here. Nicole Ford is live with those new details for us now. Nicole.
Kim, from the beginning, the Secretary of Health says the three ways to control an outbreak like COVID-19 is containment, mitigation, and vaccination. Now, while the first two continue to be vital, the state's turning its attention to the number three. Clinical trials for a COVID-19 vaccine continue with 6 major players across the country.
It's been an experience, and that's what I like to be involved in, experiences. And it's been going great. I've gotten 2 shots. I go back every 2 to 3 weeks.
Larry Maggi volunteered for one of those trials in July. He should finish up his part in January and hopes his participation makes a difference.
That's all we've heard the past 6-8 months is, beside the election, is COVID-19. And to be a part of maybe coming up with I don't want to say a cure, but something to keep people from getting it and being part of it, that'll be a nice legacy I can tell my grandkids.
Dr. Rachel Levine says when that vaccine hits the market, it will be administered to Pennsylvanians in 3 phases.
In the first phases, of course, we're going to be distributing the vaccine to healthcare workers in many settings and those working with our most vulnerable populations.
After that, Dr. Levine says the state will follow its vaccine plan, which could still change. Right now, leaders are revising their second draft after submitting it to the CDC. While the vaccine won't be required for everyone, Levine says the public should not be afraid to get it.
We'll have gone through the safety and efficacy trials that we've been talking about, which have been, considerable. And we're going to need to work past that vaccine hesitancy.
Dr. Levine says it's unclear the timetable on when those 3 phases of distribution will happen. She says it's really ultimately going to depend on which vaccine comes to market because each of them have different requirements. Reporting live tonight, I'm Nicole Ford.